Today I have the pleasure of speaking with Dr. Rob Mooney, who's from the NPHET Policy Group in the Department of Health. And we will chat about the role of social and behavioural research in strategic communications. So, hi Rob, how are you today?
Good, thank you very much, and thank you for having me.
You're very welcome to this week's Zoom for Thought, Rob. So first question for you today is, where are you located and what's keeping you sane during the last few months?
Thank you. Well, I'm working from home, as you can probably see. I'm based in Dublin. What's keeping me sane? I suppose one of the main things for a lot of people is this sort of work-life balance. So not having to commute in the morning, it's made a big difference, So when I'm not at work, I am at home. It's made things like school runs more manageable and having a bit more time, with family. Other things I think are important for us are kind of keeping relatively fit, having a decent diet, and having some sort of structure in the day as well. So there are things just to I keep focused on to ensure that I keep a bit of focus or structure on that day. Professionally, I've been lucky enough to be involved in the response to COVID in Ireland, and in a way I brought much of my training and experience to bear on this national effort, which again has been a great honour for me.
Well, actually, that's my next question. You have a background in behavioural science. And I'm just wondering if you could tell our listeners a little bit about your background and your research background and what makes you so passionate about behavioural science.
Thank you. I think it started actually as a graduate in UCD, where I did sociology. That began my interest in sort of studying society and understanding how things tick. But the core of what I do is identifying and better understanding what barriers exist for people to improve their overall quality of life. And again, differentiating between those that are within someone's control and those that are not. So if you take health as an example, so do you have enough information, accessible to you in a meaningful way to make a good choice about your own health and well-being? And then do you have the time, the knowledge, the resources, and the capacity to act on that choice? So these are the key things that I think our research in behavioral science tries to explore, and then tries to come out with different ways of being to support people in accessing that quality of life.
Okay, so along those same lines of just what you've been speaking about there, I want to ask you a question about the evidence-based behavioural research programme that has been used to inform communication strategy over the past few months of the pandemic. Maybe you can tell us a bit about that.
Sure. So at the moment, as we know, there's no known medicines or vaccines or herd immunity to suppress COVID-19 in our communities. So at the very start of the pandemic back in March, and informed by, say, the WHO and the ECDC, we developed a weekly survey to understand, it's a nationally representative sample of the population, I should say, sorry, to better understand how people are coping with COVID, what they understand by COVID, where they're getting their information from, what's the emotional state of the nation, how are people handling this? How concerned are people about different facets of this? And then how are people adopting this information and applying it in their behaviors to ensure that they're adopting these public health measures and guidelines? So that really allowed us from the very start to understand all of that wide spectrum of public engagement with that communications, and also measure how effective we were being. Because again, going back to the original point, fundamentally, our key tool in our arsenal in suppressing the virus is behavioural change in the public, and our role was to ensure that people had the tools to do that properly.
Okay, so that actually brings me on very, very nicely to my next question, and it's about your association with the NPHET Behavioural Change Subgroup. And maybe you can tell our listeners a bit about this subgroup, please.
Excellent. Yeah. So again, it sort of builds on the research program that we're doing and some of the work and the network that I would have established many years ago whilst working at UCD. At the start of this, again, recognizing that we needed to encourage and promote behavioural change, we were asked to establish the NPHET Behavioural Change Subgroup. So this was bringing leading behavioural scientists from Ireland together to form an advisory group and also conduct a series of behavioural studies. This included Professor Liam Delaney, formerly of UCD, Professor Pete Lunn of the ESRI, and a number of other key experts. So we carried out 4 key studies. The first was on public health messaging, as I just discussed. So understanding how people were able to actually enact these messages and bring it into what they were doing. So hand washing, hygiene etiquette, social distancing, all of those things. We did a second one on did people really understand how to go about self-isolating if you were notified that you were a close contact? Because it's one thing knowing how to do it, it's another thing actually doing it. We also looked at easing restrictions. So how did people feel about that? I think a very interesting finding from that was people did not want the government to go too fast. They didn't want to end up in a yo-yo effect where we were easing restrictions, going back into lockdown, etc. Now, I know we're talking today in a very specific context. However, this is, we are doing the absolute best to ensure that this is a smooth transition as possible. Sorry, and the final one then was looking at the track and test system itself. So did people understand it? Were people comfortable with that track and test system? So these are key things for us to understand to enable us to communicate to the public in a better, more effective way.
Okay, and just I suppose my last question in our 5 questions in 5 minutes is, what is the biggest challenges you've seen through the findings of your own research?
Well, I think the challenges that we've found are probably in understanding how can people use the information and, as I said already, translate it into their behaviors. But I suppose what's really come through the research for me is honestly just how resilient and actually creative people have been. We've had really interesting findings coming through. This might sound very, very simple, but one example that came through some of our research was 2 younger people who went down to the beach and actually drew a volleyball court on the sand and used that to play a game of volleyball because they knew that was a minimum of 2 meters distance apart, and it was a way to be out in the air, getting exercise and actually engaging with each other safely, socially. I think in addition to that, outside of health, it's brought a new appreciation for things like work-life balance, for the environment, for family time. I think it's created a space where we're reflecting on life to a certain degree, and I think that's opened up opportunities. And I think finally what I'd like to say is that the work and the innovation and the creativity that's gone on across all of society, but also say within the health service, within the government, within business, within the arts sectors, etc., has really shown how we can collectively respond to key societal challenges. And personally, whilst we're in an absolutely critical situation, I think it's very encouraging to show how, or to think through how we might apply that kind of thinking to other areas, such as the environment or some other key challenges we might face going forward.
Great, thanks so much, Rob. So there's lots and lots of questions coming in for you, Rob. But first question for you is in relation to the COVID tracker app. And I believe we were chatting earlier, you were involved in this. So maybe you could tell us a little bit about the COVID tracking app that you were involved in.
Yeah.
And its strengths and weaknesses. So somebody's asked the question about strengths and weaknesses of the app. Sure,
no problem. So very briefly then, in April, we established the app development team. That was a team comprised of many different sort of government departments, the HSE and a number of other institutions, working closely with Google and Apple, who are developing some of this software to develop a COVID tracker app for Ireland. The key purpose of the app was to digitally contact trace close contacts of confirmed cases. Now, the key deliverable of this app was that it allows you to identify close contacts who you don't know. So if you are out and about in society, as we reopen society, it would allow for the immediate identification of close contacts, and that will speed up that entire process. So basically, if you reduce the time it takes to identify a close contact or for that person to self-isolate, you reduce the time that the virus can circulate in the population. And as I said, also identifying people that you don't know. That can't happen through the manual system. But this fundamentally was not just an exercise in developing technology. It was kind of a journey of co-creation amongst the government stakeholders and engendering trust in the Irish people. Because fundamentally, there's no point in developing this wonderful, amazing technology if people weren't going to download and use it, okay? Because its success is based on the more people using it, the more effective it's going to be. So building on all the research and the behavioral program and the NPHET group that I've talked about already, we informed the design of the app, the communication strategy around the app, and we planned according to all of that evidence base. So now we've had over 2.1 million people downloaded the app. We've an active user base of 1.3 million people. which is 35% of the adult population over 16 in Ireland. That makes it one of the most successful apps in the world. And this isn't a boast about our success, it's a testament to the collective response that the Irish people have been engaging with us through.
It's a huge response.
Sorry, just a very last thing.
Yeah, go ahead. Yeah.
Proud of is that the app has been recognized across the world. So different states in America, different countries have used the approach that we've taken, the source code and the communication strategy to design their apps. And in fact, we were one of the first apps in the world to be interoperable with other apps. So that in time will support, and I know again, we're in a very specific circumstance under level 5 now, but that will allow for safer international travel going forward, because different apps in different jurisdictions will be able to swap those anonymous keys.
Yeah, I saw that in the news yesterday in Italy and Germany. But actually, we've just for your interest, we've a comment in saying, believe it or not, the COVID tracker app does not seem to work on phones, but in the US, even with an Irish SIM card. So that might be something that you already know about, but it's something maybe you can bring back when there's a comment in.
Thank you.
Yeah.
Just to that, and just to be clear, like frankly, this was a project that was done in 4 months. These, as I understand, I'm not a technologist, but as I understand, these are usually 2 to 3 to 4 year endeavors. And but I have to say that it has been launched almost without flaw. We had 1 or 2 very minor sort of iterative tweaks we had to create. It's absolutely been a fantastic success.
No, it's great and well done on that. So we've absolutely tons of questions coming in, Rob. So I'm going to try and get through as many as possible. So here's one for you. COVID is the problem of today, but there are lots of issues that require behavioural change. What other areas or tools do you use to reach these non-compliant people?
Well, I may have sort of primed that in one of my previous statements, but one of my previous areas of research before joining the department was environmental sustainability. So frankly, I think the application of behavioral science to improving people's behaviors or sustainable behaviors is a really, really interesting space. And there are serious experts in that field, far more knowledgeable than I. But to give one very simple example in terms of recycling. So a good behavioral nudge that was applied to university campuses, I think it was in the US, was as opposed to having just bins with a, say, recycling picture or a picture of just rubbish, etc., on it. And they had those bins in one part of the campus, and they measured exactly how those bins were used, i.e. did you put the recycling in the right bin and the rubbish in the other bin? Then they also developed bins that had pictures of landfill and then pictures of a nice clean recycling facility. And they found really, really simple nudges, but the waste that was put into them was far more appropriate than the waste put into other bins. So if you take a really simple example of that, you can encourage, by choice architecture, you can encourage people to be more adherent with the appropriate actions.
Okay. So a question about your own professional work. So there's a question in from Oscar Mooney. He says, what modeling techniques do you use most in your professional work?
Well, I would be more involved in sort of the design of the research programs, to be honest. So I'm a social and behavioral scientist in terms of design, program design and direction. I do have teams such as the ESRI would be the guys far better able to answer that question than I.
Okay. What are the key lessons learned from the first lockdown, which we can bring to level 5 for the coming 6 weeks?
Key lessons.
Yeah.
Well,
I suppose in terms of behavior, maybe, yeah.
It is, yeah, and I think, okay, so one of the studies that we did, again, was exploring, I think as I touched on at the very start, what were the different things people were doing that were having a positive effect on well-being. So we know that exercising outdoors, engaging with family time, pursuing a hobby, having a structure to the day. And again, I applied this literally in my day from part of that study, but there are things that were having a positive effect on people's lives. So personally, I think if people were to think through some of those and apply some of those to their day-to-day lives, it provides a little bit of focus and a little bit of Yeah, it allows you to get outside just the sort of, level 5 restrictions, etc., and look at, well, what can I now do with this time? What are the things that I would like to achieve, or can I do better? And I think they're the things that I try to emphasize and focus on.
Okay. So time for probably two very quick more questions. So in your opinion, what country worldwide has the best communication strategy regarding COVID?
That's a tough one, and it may sound self-aggrandizing, but Ireland genuinely is doing extremely well in a lot of our work. We have much of the social and behavioral research that we've carried out has really informed our communications strategy and programs. We've been out in the front of this from the start, because we started this in March and April. And in fact, I collaborate with the WHO on their Behavioural Insights program, which is being rolled out in other different countries. So to name one or two countries that are being very successful with this, so the Netherlands, Germany, and Denmark have also applied similar survey instruments and tools to inform their communications and thinking. So they are countries that I think have also been successful. But I will say Ireland really has been at the forefront of this from the start.
Okay, and just to finish then, Rob, we've so many questions, I'm just trying to pick one to finish on, and it's a personal question. And how worried would you be personally about COVID-19 right now?
Well, again, not depersonalizing the question, but we've seen from our research, you track the level of worry from the start. So we've seen it go up to a peak of 7.4 out of 10, down to about 5.3 around the first easing of restrictions, and that's risen back up to about 7.2. I'd say it's a blunt measure in that we're getting an overall level of worry. So whilst I would be concerned about COVID, and rightly so, because we should be, this is a virus, this is contrary to some popular social media discourses, this is not the flu, this is not something like that. It has an impact on people. Personally, I suffer from asthma, so I have underlying conditions, but I also have an elderly parents who I would be very aware of, my responsibility to not pass it on. So I think reflecting some of our research, I'm not as worried for myself, but I would be very aware of my role and my responsibility in our collective efforts to suppress the virus. And I think that's the way I'd like to think about it.
And that's a really nice way to finish on it, because unfortunately, Rob, we are completely out of time. So sincere apologies to those of you in the audience whose questions I did not get to. But I just want to take this opportunity to say a huge thank you to Rob. Thank you so much, Rob. Fascinating discussion today.
Thank you very much.
Thank you so much. And thanks to everyone else for joining in. We run these Zoom for Thought series each Tuesday. So please, you can sign up at zoomforthought.ie, and you can also check out our list of upcoming speakers. So thank you so much again, Rob, and thanks everyone. Have a great day and see you all next week on Zoom for Thought. Thanks so much.